Sure. MATTERHORN study is a large phase 3 study assessing the utility of perioperative immunotherapy with durvalumab anti-PD-1 therapy in combination with FLOT compared to FLOT with placebo. This is a phase 3 double-blind placebo-controlled study enrolling patients across the world, and it's the first study to attempt to standardize therapy perioperatively with FLOT. FLOT, as we know, worked well in German patients and has been increasingly accepted in the Western countries. In Asia, really the standard has still been either two-drug combination or surgery followed by adjuvant therapy. So MATTERHORN demonstrated that the addition of durvalumab to FLOT improved complete response rate, pathologic response rate compared to placebo. This was a statistically significant difference of 12%. And at this Congress, we presented the expanded analysis by regional differences because this, as we know, this disease can exhibit different responses across Asia versus non-Asian patients. So we demonstrated that in our trial, the efficacy and the path-CR rate was very similar across the globe. We demonstrated that FLOT was tolerable and feasible in Asian countries, non-Asian countries, in different North American, South American countries, and the odds ratio across different subgroups favored durvalumab. So this is very promising data. It's not practice-changing data. We're still waiting for the primary endpoint, which is event-free survival, to demonstrate that the path-CR rate actually translates to more patients being cured and disease-free will be very important. What is reassuring is that we saw a significant downstaging and node-negative status, which has been in other studies correlated with survival outcome. So at baseline, approximately 30% of patients across the two arms were node-negative, so predominantly 70% were node-positive, and then the durvalumab arm, the node-negative patients, pathologically node-negative patients, was 50%. So we're hopeful that the event-free survival will also be met, but it's to be determined. FLOT has a reputation of being a difficult regimen to give. Quality of life improves, gives us a sense of how tolerable it was. From the chemotherapy delivery standpoint, on the study, 96% of patients were able to complete all preoperative FLOT, which is 4 cycles. And so far, we have close to 65% of patients who were able to complete all adjuvant therapies. And this is in a global phase 3 study across all countries, all regions. Again, showing that in the modern oncology world, FLOT is actually quite doable. FLOT is a reasonable option. In some parts of America, United States, we still lean on radiation for chemoradiation, and here FLOT is coming in strong, particularly in combination potentially with immunotherapy. But as I mentioned, MATTERHORN is not yet practice-changing.